Talk to me, I guess, a little bit about some of the bigger picture stuff around the solution that you've built. So I'm curious about why you're tackling diagnostics with your technology. I mean, what is the opportunity that you see there from a market standpoint?
Yeah, so, what we really see is the earlier that you can give someone information that they can act upon, the better for many different diseases. And lung cancer is a classic disease for this case. It's oftentimes branded as as the deadliest cancer, and indeed it is. But what they don't tell you is that if you detect it early, the 5-year survival rate can be incredible. And so what we see is we almost view this opportunity in sort of the same way you'd view a therapeutic opportunity, but with a different risk profile to a therapeutic, in the sense of the go-to-market strategy. And the reason I frame it like that is that with proper implementation of the technology, we could actually see survival rates of the entire patient population transform the way that a good therapeutic would transform survival rates for a patient population.
Okay, and forgive me if Jonah asked this already, but why did you start with lung cancer?
Yeah, so it's a really interesting convergence of things. One is I've actually sort of been touched by lung cancer in my family a few times, and that's obviously creates a personal motivation, but that's not really enough, right, from a business perspective.
Need a business case.
Indeed. And so we actually did a program called the National Science Foundation I-Corps, where we interviewed intensively about 150 different players in the space, but we never told them about our technology. We were just looking for the problem and what the willingness to deal with the solution was.
Okay.
We looked very closely at a number of, as Jonah mentioned, other breath-based diseases, but kept coming back to lung cancer because...
Share with me a little bit about the problem, like as you uncovered it. I mean, because I'm familiar with that I-Core methodology, and it's intense. I mean, like they make you go, you have to interview all these people, find out about the problem space. So you're not just slapping a technology at a problem that doesn't need solving. So what did you find out specifically about this problem space?
What we found was hospitals are highly incentivized to care for patients at the earliest stages. But with lung cancer, they're just not getting adoption of the screening process. It's about 2% of the addressable market is addressed via the current system.
What's causing that low adoption rate?
Exactly. So it's actually that first interaction. When someone is in that room with the primary care physician, the PCP says, hey, you're a certain age, you have a certain smoking history, you need to get screened. For whatever reason that's not compelling enough, it's usually not compelling enough because getting screened requires a separate visit at a separate location.
Sure.
What we heard time and time again in those interviews was if we could do something right there in the PCP's office, that would transform the way the patient thinks about their condition and thinks about their potential path forward.
Okay, and so explain to me, like, I guess, as far as like, I mean, you talked a little bit about cost with Jonah. So how do you bring the cost low enough where this is something that they're doing? Like they take your temperature, they do all of their other routine things, they listen to your heartbeat, they listen to your lungs, and then you blow into the straw.
For sure.
How far are we from that?
You know, I think that actually we're closer than we think. And the reason that I say that is all of the meetings that we've been having with different hospital systems and the oncology groups in those hospital systems point to a potential value-based care model where we could deliver the breath test and really return our revenue based on what happens with those patients.
Okay.
And we think our cost of goods is low enough to support that, where it's very attractive to us, but it's very attractive to them as well. They're paying if we help patients.
Okay.
Yep.
And so, I mean, I guess, like, to make it ubiquitous, like, what do you need? Like, as a startup, I mean, you talked to Jonah about a little bit about what's next, but, like, what do you need right now? Like, are you looking more for manufacturing partners? Are you looking for use cases? Are you looking for studies? Like, what do you need right now? Yeah,
so we do have an ongoing study that we're really just a quarter of the way through. We're very excited to proceed with that. But what we're really looking for right now are both manufacturing partners who can help us understand not only how to manufacture it at scale, but how to package it in a way where it's so intuitive in that primary care physician environment. And the second thing really is, you know, everything is about how that data gets handled, both from a privacy perspective, but also, again, from a value perspective to the hospital, and a value perspective in terms of just efficient reimbursement. And so we're really looking very closely at how we take the physical data on that sensor, get it into the app, and how it moves around in a way that's going to excite all the different players.
Okay.
Yeah.
All right, I need to wrap up. I'm getting the nod from
I
Natalie
understand.
back
Yes,
there.
that'll happen.
Joe, it's a pleasure to speak with you. It was nice to meet you.
Yep. Thank you so
Take
much
care.
for your time.
Thank you so much.
Yep.